Take 5 Health Literacy in 5 minutes or less. Welcome to Take 5 series Black History and Healthcare. Today, in our last segment, we applaud historically Black colleges and universities and their impact on the history of healthcare, brought to you by Porcupine Coaching Center and Healthcare Access Alliance. In 1881, a historically Black college or university started the first four-year medical school and the first school of pharmacy, and in 1886, the first formal education for Black nurses began at an HBCU. HBCUs were founded to meet the educational needs of African students that were previously excluded from attending predominantly white institutions. They provided nurturing environments for Black degree seekers with less concern about racial bias and discrimination. In 1881, the Shaw University became the first college in the United States to offer a four-year medical school and the first to offer a school of pharmacy. Leonard Medical School and the Leonard School of Pharmacy began with a $5,000 donation and opened for its first session on November 1, 1881. The Leonard Medical School Hospital, a 25-bed hospital, opened for patients on January 10, 1885. It closed in 1918 after a scathing evaluation stating it was in no position to make any contribution of value. Founded as the Atlanta Baptist Female Seminary on April 11, 1881, is Spelman Seminary, now Spelman College. Spelman began a formal education exclusively for Black nurses with the establishment of a nursing program at its Atlanta campus. Howard University Hospital was founded in Washington, D.C. in 1862 as Freedmen's Hospital to serve the Black community. It was the first hospital to provide medical treatment for former slaves. After the Civil War, it became the teaching hospital of Howard University Medical School, which was established in 1868. Prior to 1874, it was run by the Freedmen's Bureau in the United States Department of War. In 1874, it was transferred to the Department of the Interior, and in 1940 to the U.S. Public Health Service. Founded as the State Normal College for Colored Students in Tallahassee, Florida in 1887, it became Florida Agricultural and Mechanical University, FAMU, commonly known as Florida A&M. In 1909. It is the third largest historically Black college or university in the U.S., and FAMU offered the first baccalaureate nursing program for Black nurses in 1936. In 1951, the university started a pharmacy program, and in order to give students hands-on experience, the university built Florida A&M Hospital, the only hospital within 50 miles of Tallahassee to serve African Americans until 1971. Of the top 10 undergraduate feeder institutions for medical school, 3 are HBCUs: Spelman, Howard, and Xavier in Louisiana. They are all top producers of medical student aspirants. Many more schools were founded out of the sheer necessity to train Black and healthcare professionals to take care of Black patients. Today, historically Black colleges and universities continue to play a major role in training Black healthcare professionals who are making a difference in all aspects of the healthcare industry. Take 5 Black History in Healthcare remembers historically Black colleges and universities that significantly impacted the history of healthcare, including starting the first four-year medical school, the first school of pharmacy, and establishing the first formal education institution for Black nurses. Thank you for tuning in for our series Black History in Healthcare, acknowledging the impact of Black professionals and historically Black colleges and universities on the advancement of healthcare for minority populations. Lastly, like us on Facebook and subscribe on YouTube for notifications. Take